The vagus nerve, your body's superhighway to health. This is part one of a multi-part series. I'm going to be breaking this up because when you're dealing with long COVID, you just plain old don't have the focus most of the time or the energy to sit through a whole seminar. So we're going to be breaking this up. This is just a basic overview of what the vagus nerve does and a few tips that can maybe help until we can dive further into it in following videos. Now I need to put this in there for educational purposes only, not intended to diagnose or treat any condition. Consult with your care provider for guidance. Let's start with the cranial nerves. There are 12 of them, and each one of these does something specific. Number one would be the olfactory, which is your smelling nerve, which connects from your scent to your brain. Your optic, which is the for eyesight, and all the way down. Facial nerve, you can see all of these. The tongue is number 9. The one we're going to be looking at is cranial nerve 10, and that one is considered the wandering nerve, and we'll find out why. Now, while this is a cranial nerve originating from the brain, the vagus nerve is considered a part of the peripheral nervous system. It carries signals from the brain to various organs and sensory information back to the brain, but it doesn't reside within the brain or spinal cord, which are the main components of the central nervous system. Now let's take a look at this. You can see at the top there the nervous system, which is the central nervous system, which is considered the brain and spinal cord. Then you have the nerves, the cranial nerves that are in the brain that are not part of that. You go over to the right, you see the peripheral nervous system, and it drops down to the autonomic nervous system, which communicates with the organs and glands. That's what we're going to be looking at. And the somatic nervous system, which communicates with same organs and voluntary muscles. You just follow that down. You can see the rest and digest, which is a calming parasympathetic division on the left. And then you have the sympathetic, which is the fight or flight. If you go over to the right on the bottom, you'll see sensory or afferent nervous system, which is what is input to the brain, and it tells the brain what's going on. And the motor or afferent nervous system is it's the one that is telling the brain tells the muscles or the organs what to do from there, essentially. Now, let me just go through this a little bit more. The sympathetic nervous system, like I said, activates the fight or flight. During stress, it speeds up the heart rate, widens airways, redirects energy to muscles while slowing the digestion. So with long COVID or any virus, that is normally where your body is stuck in overcharge there. It raises cortisol levels, and your body kind of just shuts down thinking it's in trouble, which it really is with the COVID. And then you have the parasympathetic, which is the rest and digest activities, which calm the body, slowing heart rate, aiding digestion, conserving energy when relaxed. These are supposed to be in balance depending on the situation, but a lot of times, or probably most of the time, anybody suffering with long COVID is stuck in that sympathetic nervous system. And we'll go into that a little bit more. The vagus nerve also serves as a bidirectional communication link between the brain and essential organs. Often referred to as the wandering nerve, it plays a significant role in regulating heart rate, digestion, inflammation, and emotional balance. As a part of the nervous system, the vagus nerve is crucial for maintaining overall health. Take a look at all the places that the vagus nerve touches: lungs, bronchia, heart, esophageal, celiac plexus, liver, spleen, stomach, pancreas, kidney, colon, small intestine. I think you get the idea. It goes everywhere. So organ regulation, as far as the cardiovascular goes, it modulates heart rate and blood pressure. High vagal tone is linked to lower resting heart rates and faster recovery after stress. Digestive system stimulates stomach acid production, intestinal contractions, and enzyme secretion. It also relays satiety signals to the brain. Respiratory system coordinates breathing patterns with slow, deep breaths enhancing vagal activity. Inflammation control detects inflammatory cytokines, we'll be talking more about that, and triggers anti-inflammatory responses via the inflammatory reflex. That is where a lot of our problems, the spike protein not only attacks the organ directly, but it can attack the nerve, and it's just a cascading nightmare. The vagus nerve influences mood by connecting gut health to brain function. Poor vagal tone is associated with anxiety, depression, and impaired stress resilience. It also plays a role in social bonding and emotional regulation. Now, we talked about heart rate variability. HRV is a measure of vagal tone, correlates with stress resilience. Higher HRV is linked to better emotional regulation and cardiovascular health. Exercises like deep breathing can increase the HRV by 20 to 30% within weeks. And we'll give some examples of deep breathing here. There's two different types of breathing. There's breathing to stimulate the metabolism and another type of breathing to calm. We want to be looking at the calm. Now let's take a look at COVID and vagus nerve disruption. The SARS-CoV-2 enters the vagus nerve just like it does other organs by gaining entry through receptors on host cells, such as the ACE2 receptor, and there's others. Just like the protocol for organs attacked by spike protein, the McCullough protocol of nattokinase, bromelain, and curcumin, along with other supplements, are vital in removing the spike. Remember, though, when you're doing these protocols, to work with a practitioner. It's very important. Damage to the vagus nerve can take its toll. It takes time and consistency to repair the damage that has been done. The supplements will only go so far in healing. Quality sleep, nutrition, and lifestyle are equally, if not even more important, keys to health. We will delve into these topics in upcoming videos. Inflammation and the cholinergic anti-inflammatory pathway. Say that 3 times fast. Spike protein is the culprit. The vagus nerve can detect the pro-inflammatory cytokines via sensory fibers. So what happens is it kind of goes wonky and it doesn't do what it's supposed to do. Normally it's supposed to release acetylcholine, which binds to receptors on immune cells and suppresses inflammation. Clinical studies show that vagus nerve stimulation reduces inflammation, which means you have a higher vagal tone, just like you would with heart rate variability, and can reduce inflammation in rheumatoid arthritis and Crohn's disease. Both of these are autoimmune diseases. So it goes without saying that it probably can help with a lot more things than just those 2 diseases, autoimmune at least. So here's some symptoms of low vagal tone and what you can do about it. For the physical, it'd be rapid heart rate, indigestion, constipation, chronic inflammation. For psychological, anxiety, brain fog, poor stress management. Some conditions that are linked to vagal dysfunction are, like we said, the gastrointestinal disorders, irritable bowel, and inflammatory bowel disease, cardiovascular issues, arrhythmias, hypertension, increased risk of heart failure, mental health challenges, depression, PTSD, chronic fatigue syndrome, and of course anxiety, which isn't in there. And autoimmune diseases, rheumatoid arthritis, lupus, these are driven by unresolved inflammation. All of these are. Exercises to tone the vagus nerve. We'll start with box breathing. This one was developed by the Navy SEALs, the government, to help the Navy SEALs before they went into assignments to be able to calm and focus. So this one is a very good one for that. Box breathing, you can look it up for more information on it. Just type in box breathing. It is a proven, scientifically proven way to bring down those stress hormones, which will calm that inflammation. It's also called square breathing or 4-square breathing. This is a deep breathing exercise that involves inhaling for a count of 4, holding for 4, exhaling for 4, and then holding for 4 and repeating. This technique can help calm the nervous system, reduce stress, and like I said, improve focus. Humming or chanting. Hum a tune or chant for 5 to 10 minutes daily. Believe it or not, this does work. It stimulates the laryngeal muscles, directly activating the vagus nerve. And what that'll do is it'll help tone it. Cold exposure. This one I don't recommend unless you're used to it, and I would talk to a practitioner. Probably the splashing the cold water on the face would be okay, but the 30-second cold shower is probably not good if you have cardiac problems or you already are compromised, but it's one that they've recommended, so I'll put it in there. It triggers a diving reflex, which slows the heart rate and boosts your tone. And like I said, only attempt this under professional guidance. Yoga, prayer, and meditation. Of course, these are widely known practices. They reduce the sympathetic dominance and enhance interoceptive awareness, meaning that it's, in English, that just means that it's calming your nervous system down. Now, this is one that a lot of people don't realize, but gargling water vigorously for 30 seconds, 2 to 3 times a day, which just like with the humming, engages throat muscles connected to the nerve, improving its responsiveness. This is proven. All of the things that I'm giving you here are proven. Now, as far as foods go and diet, you want to look for foods that are rich in choline, like eggs, organ meats, and fish. Organ meats have all kinds of wonderful benefits that we don't, in our Western diet, don't normally think about using. You can incorporate them in, like with burger. You could put liver and burger together, cook that up, you don't even notice it. And fish, especially cold water fish, this can help stimulate the vagal tone by supporting the production of that acetylcholine that we talked about, that neurotransmitter for the parasympathetic nervous system, that which will calm and lower the cortisol levels. Additionally, consuming a wide variety of vegetables and fruits, including fermented options like kimchi, kombucha, yogurt, those kind of things, kefir, which is a really good one, and we will be going into more fermented foods and recipes on that, because I truly believe that a lot of health starts in the gut. 90% of your immune system and also your emotions, your serotonin, are located in your gut, in intestines. In addition to the McCullough protocol, which I will be doing a separate video on, supplement recommendations that can help activate the vagus nerve include GABA, which is an over-the-counter supplement, magnesium, healthy omega-3s, such as fish oil or something like that. There's also krill oil that I think actually has a better profile for that. Pre and probiotics. Believe it or not, salt can help, sodium, vitamin B12, and of course vitamin D. And if you haven't had your vitamin D level done, please consider having it done. In addition, while I was researching, I found out that lion's mane mushrooms has a proven track record to regenerate nerves. So look at that. And if you're going to get lion's mane mushrooms, make sure that they're a good quality. Now, here's one that a lot of people do use, and it seems to work for a lot of people, is the TENS unit. And this is something that you would attach to the back of your neck, or it'll come with directions. You can buy these machines on Amazon even, and they're not very much money. And they stimulate the vagus nerve, increasing vagal tone. This is another one that I would talk to a practitioner about before you do anything else. Now, on top of everything else we talked about, which was consuming or putting things on, quality sleep is imperative and foundational to healing long COVID. It remains elusive to many. Be sure to shut off the Wi-Fi and put that phone on airport. And the reason why is that depletes melatonin. Melatonin is such an important chemical for your body to be able to get into sleep. Also try magnolia. They have magnolia root, magnolia extracts, and these contain what's called an ingredient called hanacoil, which is an anti-anxiety and calming supplement. It also has been shown promise for some types of cancers. Also avoid eating or consuming caffeine or alcohol too close to bedtime. I think we all know that. Avoid strenuous exercise before bedtime, which can stimulate and keep you from falling asleep. And we will be doing a deep dive into sleep and how it affects health in the next video. Because I believe that sleep actually is the foundation to health. So to conclude, the vagus nerve is the master regulator of physical and mental health. Simple daily practices can enhance its function, mitigating inflammation, improving digestion, and fostering emotional balance. By integrating vagal toning exercises, supplements, diet strategies, and good quality sleep into your routine, you can unlock a powerful tool to heal from long COVID. But remember, even after the spike protein is gone, the damage is done, and it can take a long time to heal. The real key to all of this is consistency. And also I want to mention that nothing in this recording is intended to diagnose or treat any illnesses. I have to put that in, and to talk with your care provider about anything that we have talked about if you have questions.